Now, let's say we have an alcohol overdose. What would we give them here?
Is it thiamine?
Okay, so thiamine, what is thiamine?
Is it a vitamin?
It
Vitamin
is a
B?
vitamin. Which vitamin is it?
Vitamin B? B1?
Which one? Say it again.
B1?
Nice. Check you out. It is vitamin B1 since you want to show off. Let's go. Let's go vitamins. You notice I can just sit here with no notes and just go from anything to anything? I'm not doing this to impress you. This is exactly where I want you to be. Man, guys, check this out. Don't tell the ladies. This is the first time ever we've had an all-guy crew. I like this. This has never happened, ever. All right, so let's hit up some vitamins real quick. All right, when it comes to vitamins, now I'm going to come back to the overdoses, but let's go over vitamins real quick. I don't actually think I've ever done this in any situation, in any EMS situation. All right, so vitamins are broken down into water-soluble vitamins and fat-soluble vitamins, okay? This is a good thing to know, though, just in general. These are your options. It either breaks down through water or it breaks down through fat. All right, Winchell, we'll take you out for just a moment. Give you a break here. All right, so this is for everything. All medicines work the same way. They either dissolve in water or they dissolve in fat. Let me tell you why you care. Why do you care if it's water soluble or fat soluble? Let me show you. If it's a water soluble, so let's put water in blue. That makes more sense. If it's water soluble, the primary organ that's going to help to metabolize it is the kidneys. There's a lot of water, there's a lot of blood in the kidney, flowing through the kidneys. That's the job of the kidneys, to filter blood. So anytime you have a water soluble thing, if it's likely to mess up an organ, it's likely to mess up your kidneys. Okay? Now, how would somebody detect that somebody has some kind of kidney problem? We're probably going to see changes in the kidney labs. What are our primary kidney labs that we use? That's going to be our BUN and creatinine. Now, and by the way, this is BUN and not BUN. It's BUN. That stands for blood urea nitrogen. So anytime somebody has some kind of kidney problem, they're probably going to have an increase in their BUN and an increase in their creatinine labs. Okay. Now, obviously, you would need to know what the labs are to know there's an increase. I'm not going to go into labs today because that's a whole other topic. But what you want to know, and check this out. If you have something that is metabolized by the kidney, it's water soluble, and it's also typically going to be a very small molecule. Okay. I'm sorry. No. It's going to be a large molecule. A large molecule. Okay. And it's transported through water. The issue with a large molecule, or kind of the benefit of it, is it has a hard time getting into places because the molecule's size is so big, it has a hard time like sneaking in little cracks. Okay. So how can that be a benefit? Well, that means that it has, when it's water soluble, if the molecule is big, it has a hard time sneaking into places, so it's less likely to travel everywhere. Okay, so we call that volume distribution. Volume distribution, everybody just stay with me. I'll make sense of this. Volume distribution is how much gets distributed everywhere. When you have big situations, big molecules that are big sizes, it's hard for them to go everywhere. So they kind of stay in one place. So for instance, like in the kidneys, they kind of stay in the kidneys. And this is why they cause kidney problems or kidney failure and not so much other situations, because it kind of stays right there. It can't really get out. Okay. So it has what's called a low volume distribution. Water-soluble things are metabolized by the kidneys. If we have kidney problems, it's going to affect our kidney lab. So we're going to have an increase in our BUN, increase in our creatinine. Now, the good thing, though, is when you have a water-soluble situation, also, these things typically behave like an acid. This is why when you have, this is why the treatment for most acid-type overdoses is some kind of water. Does that make sense?
Yeah. Yeah.
Okay. Now, see how I was talking about vitamins, but we're going to tie this into, we just talked about a tricyclic antidepressant overdose, which behaves like an acid. The reason, since it behaves like an acid, one of the things that we can do is we give them water to neutralize the acid. This is why fluids is first, and then later we can also give bicarb to neutralize the acid. Okay. Now let's talk about water soluble vitamins. The water soluble vitamins are going to be your B complex vitamins and your vitamin C. So B and C. So BC, like before Christ, or like a BC powder, those are your water soluble vitamins. Now, all right, hold on. Let's make sure we can see this. When it comes to the B complex vitamins, we have several ones. We have vitamin B1, B2, B3, B5, B6, B7, B9, B12. Okay, vitamin B1, that's the one that's known as thiamine. Okay, what happens if you have a thiamine deficiency? Who has this? Well, alcoholics. So when Chell said, okay, in an alcohol overdose, we may give thiamine. That's mainly a, so yeah, we could give thiamine, but it's just a vitamin at the end of the day. So it's not going to make that much of a difference. The main thing, let me come back to that. The main thing that we're going to give in a alcohol overdose is we actually give them methanol a little. But then we also need to give them, because all this alcohol or methanol, remember how I said that methanol behaves like an acid and causes metabolic acidosis? And what did I just say is the first thing that we do for any kind of these acidosis situations to neutralize the acid?
Fluids.
Aha. So in an alcohol overdose, this is why all of them end up getting IV fluids, okay, to help kind of neutralize some of the acid. There again, we may also have to give bicarb later, but we may, in addition to that, have to give them a little methanol. Now let's go back over the vitamins real quick. You don't have to know all of this part, but if you've heard these words, I want you to just kind of make some sense of it. Anybody know what vitamin B2 is called? Okay, let's go back to B1. Thiamine. The reason you need it is if you don't have it, two things that it can cause. One of them is beriberi. Okay, there are two flavors of this. We call it dry or wet beriberi. The two flavors of this, one of them causes neurological disorders. One of them causes heart failure. Okay, so if you don't have thiamine in your diet or in supplements, it can lead to a situation called beriberi. Neurological beriberi is where you're having brain problems, or it can cause heart failure. What's vitamin B2? That's going to be riboflavin. That's found in milk and lots of other animal sources. If you don't have it, it causes things like angular chelosis, where you get these sores on the corners of your mouth, stuff like that. Vitamin B3, that's niacin. This is needed for a whole lot of chemical reactions in the body, but niacin. If you don't have enough niacin, it causes something called Hartnupp's disease. It also causes diarrhea, dementia, It can lead to death. Okay. All right. What's vitamin B5? Vitamin B5 is, anybody know? All right. Vitamin B5 is pantothenic acid. It's also needed for it's a main ingredient for a lot of chemical reactions that take place in the body. So that's pantothenic acid. Vitamin B6, that's pyridoxine. And you can just look this up. You can just Google or ChatGPT or Gemini or whatever your source is. You can just look up, okay, give me a list of the vitamins. Vitamin B6, it's needed for a lot of stuff. When you don't have enough of it, it causes things like peripheral neuropathy. So it causes numbness and tingling in your fingers and toes and stuff like that. So if you have any patient with some kind of neuropathy, one of the levels you want to have checked is their vitamin B6. Now, why am I telling you this stuff? Is this stuff on National Registry? No. But sometimes you may be the most educated medical person in some kind of situation, and nobody else knows this. So the more you know, sometimes it tells you what to do, sometimes it tells you what not to do, but it also allows you to better educate your patients, your family members, yourself. Okay. So pyridoxine, vitamin B6, it's going to be used for preventing things like peripheral neuropathy. So nerves need vitamin B6 in order to do their job. Vitamin B7, that is, say it again. Oh, okay. Vitamin B7, that's biotin. Biotin is needed for muscle building. It's also needed to make hair, skin, and nails. So a lot of women who take some kind of vitamin B7, it's to help their nails and their hair and their skin look good. Their nails and hair grow and their skin look good. Vitamin B9 is folate. Okay. Vitamin B9 is it's needed to make DNA. If you have, this is why pregnant women need to take prenatal vitamins, because one of the things in prenatal vitamins is folate. If, let's say, a pregnant mom doesn't know she's pregnant, or she's not taking her prenatal vitamins, she's not getting folate, it's hard for the baby to develop, especially their brain. So they can now have like neural tube defects, like spina bifida occulta, things like that, where they literally have like their brain doesn't even develop, or they have like either no brain or a small brain, or they have problems with their spinal cord, those neural tube defects. So folate is needed like for life. And this is why pregnant women have to take a prenatal vitamin, because it contains vitamin B9. And then vitamin B12, that's cyanocobalamin. Cobalamin. Okay. This is also needed for nerves. So whenever somebody has neuropathy, we want to check their vitamin B6 level, their B12, and also their B9 level. So this is a case for why you want to make sure that your diet is good, so that you have all the essential vitamins that your body needs. Your body can make some things, but some things you have to have it synthesized, or you have to get it through food. This is a case for why you want to take vitamins, or at least why preferably you want to get it through your food or through your diet. But if your diet is just trash, like a lot of people in EMS, you definitely want to supplement your diet with some type of supplement that definitely contains these B complex water soluble vitamins. Okay. The other water soluble vitamin is vitamin C. And then the fat soluble vitamins are going to be A, D, E, and K. Let me tell you about these really quickly. Because they're dissolved in fat, where is a place where it's very fatty in your body? That's going to be your liver. Okay, your liver. So when somebody has an overdose on any kind of fat-soluble substance, whether it's vitamins or anything that's dissolved primarily in fat, it really destroys your liver. So how would you recognize it that somebody has some kind of liver problem? We're going to see an increase in the liver labs. That's going to be an increase in our ALT, alanine transaminase. That's going to be an increase in our AST, our aspartate transaminase, and our GGT. So when you look at labs sometimes and you see in your lab report, okay, ALT, AST, GGT, these are liver enzymes. And when they have an increase in these, it's probably some kind of liver failure from too much fat soluble substances. Now, on the other hand, remember how with water things, they're dissolved in the kidney. They are large molecules, so they don't really go all over the body. They kind of stay in one place. On the other hand, these fat soluble are very small molecules. They can travel everywhere. They can sneak in all little cracks and crevices throughout the body. So they can go all over the body. They have an increased volume distribution. And what else is so crazy about this? Because they can go everywhere, they can very easily cross over the cell membrane. Well, if they can cross over the cell membrane in the brain, they can now, so in the brain, they can cause things like drowsiness, somnolence, lethargy, slow to response, unresponsiveness, things like that. Okay, let's say if I cross over membranes in the muscle, ooh, now I'm going to have things like muscle cramps, rhabdomyolysis, stuff like that. Okay, let's say I cross over membranes in the heart. Oh, now it can cause things like carditis, excuse me, pericarditis. Okay, let's say I cross over the membranes in the liver. Now it can lead to things like hepatitis. Okay, let's say I cross over membranes in the pancreas. Now I can have things like pancreatitis. Okay, now what can I do with this information? What can I do with this information now that I know this? Everything in the human body, guys, this is exciting. Is anybody else learning or just me? Here, everybody come off mute for me. All right, have I lost anybody?
No.
Okay, how are you feeling about this so far?
Are we on this ride with you?
Yeah.
Come on, check this out.
Joshua,
You're not getting this in most paramedic schools. Okay, check this out. Every substance in the whole human body, it either has one of two ways it has to work. It has to work like an acid or it has to work like a base. Okay, this is how I can take any medication in the whole wide world. I don't have to know the name of it. I don't have to understand how it works. All I have to do is ask a doctor or a pharmacist. Hey, doc, I got one question for you. How often do you give this drug? Oh, if they tell me, oh, this drug has to be given every 4 hours, every 6 hours, every 8 hours. Bingo. That's all I need, doc. I don't need to know the name of the drug. Don't even worry about telling me. You said it has to be given every 4 hours. That means it's a water-soluble drug. It's going to be metabolized by the kidneys. It's going to have low volume distribution. Because it's metabolized by the kidneys, because it's metabolized by the kidneys, when the kidneys get destroyed, we're going to see an elevated kidney enzyme. So we're going to see an increase in the BUN, increase in the creatinine. It's going to behave like an acid. Because I got too much of it, the first thing I'm going to do is I'm going to give them fluids. Next thing I'm going to do is I'm going to give them bicarb. And it's like, how did you know all that? Well, I just needed one question. How often is the drug given? Now, let's say you give me another drug and you say, hey, this drug is given once a day. Oh, once a day means that it lasts a long time. Aha, that means it's going to, instead of behaving like an acid, oh yeah, it's going to behave like a base. Okay? It's going to be a small drug. It's going to be a small molecule. It can travel everywhere. It has a high volume distribution. Because it can travel everywhere, it's likely to knock out the liver. We're going to see an increase in the liver enzymes, increase in the ALT, the AST, the GGT. It can knock out the pancreas. So I can see an elevated pancreatic enzymes, our amylase, our lipase, things like that. It can cause pancreatitis. It can cause hepatitis. It can cause carditis. It can cause myositis, rhabdomyolysis. It can cause, it can wipe out the brain and cross the blood-brain barrier. Now they're going to be sleepy. They're going to be tired. They're going to be fatigued. All I needed to know is how often is the drug given? You see the importance of why you want to know more than just what's in your textbook? How do you guys feel about this?
I feel informed.
yeah.
Okay. All right. So what we covered so far with vitamins, we said vitamins are either, but this is not just vitamins. This is every substance in the whole body. It either behaves like a water-soluble something or a fat-soluble something. In the case of vitamins, the water-soluble vitamins are going to be our B's and C's. And then we have B1, 2, 3, 5, 6, 7, 9, and 12. Okay? Those are our B complex vitamins. You can just look up the names if you need to. Our fat-soluble vitamins are vitamins A, D, E, and K. We want enough of these, but we don't want too much of these, because at least when we have too much of the water-soluble vitamins, we just pee off the rest. When we have too much of the fat-soluble vitamins, we don't pee it off. It hangs in our body for years, and it causes all these other problems that we mentioned. Okay? All right, now we went into that, and we made a connection between water-soluble things and like aspirin overdose and alcohol overdose.
Joshua, I have a question before we move
Yes.
on, if that's okay.
Huh?
The B12,
Okay.
the name of that one again.
Cyanocobalamin.
Yep.
What about
Is that why, like, I mean, I see a lot now of patients who use a lot of nitrous oxide.
Okay.
And I really kind of did a deep dive, which it all connected now, because when you said that a lack of that name, the
Cyanocobalamin.
Mhm.
What about it?
Well, people with that do a lot of like nitrous oxide, from what I think is they lose that myelin sheath around the neuron,
Okay.
which slows down the conduction. And I said, and I remember you just saying that somebody with a low B12, it affects their neural system.
Absolutely.
So kind of all put the pieces together for me then, because if they're low in that B12, then that means they're eating away at that myelin sheath, which then is affecting their neural system.
Yes.
Right?
Absolutely. Now, it can take a while for B12 is one of those things that actually stays in your body for years. It primarily comes from animal protein, but who's most likely to have a B12 deficiency? That's going to be a vegan who totally 100% consumes plant-based sources and no animal protein, and so they will typically have to supplement. But because B12 it's involved with intrinsic factor, it's involved in digesting certain bacteria, that kind of thing, but it stays in your body for years. So it actually takes years to develop a B12 deficiency, but there are things that you can do to speed it up, to get rid of more of it faster. But vegans are definitely somebody who's likely to have a B12 deficiency. Here, let's just put that. So vegans, especially vegans, are likely to have a really low B12. Okay. All right. Any questions about any of that? Like, I wasn't even planning on going into any of that, but I'm ready at all times.